Good afternoon, everyone. Before I head home for the long weekend, I just wanted to take a few minutes to talk to those people who are frustrated because their best efforts to try and lose weight are not resulting in any weight loss. So last week I talked about the connection between the thyroid and weight loss. Today I'm going to talk about insulin resistance and how that can be a factor that makes weight loss more difficult. So thank you so much for watching. I know everybody's probably got a lot going on getting ready for the long weekend. Thank you for those who are watching the replay. For those of you that don't know, my name is Dr. Jennifer Hessler, and I'm a naturopathic doctor and a mom of 3 and one more on the way in September. So I am well aware of how challenging it can be to incorporate healthy eating, regular exercise, and stress management into my busy life. And I feel like my job as a naturopathic doctor is to help coach and encourage people to be able to do that a little bit more easily. So today, to help you understand the connection between insulin and your weight, I'm going to start with a little physiology lesson again. I'll try and keep it pretty simple. Whenever you eat carbohydrates include fruits, vegetables, grains, anything that has sugar added into it. When we eat those foods, they get broken down in your digestive tract into glucose. The glucose then gets released into your blood. So the presence of these sugars in your bloodstream signals the release of insulin from your pancreas. So we've heard, like somebody who has type 1 diabetes, their pancreas does not produce insulin, and that's why they need to take it in order to be able to keep their blood sugar levels down. Ideally, when the insulin is present, it's supposed to bind to the receptors in your cell membranes and then result in the opening of the glucose transport channels, which are also in the cell membrane. And these channels, when they're open, allow the glucose to get into the cell and fuel your mitochondria, which is the energy producing center of every single one of your cells. So the job of the mitochondria is to produce ATP, which is the fuel that's needed for your body to run most efficiently. So when somebody has insulin resistance, the insulin is not able to bind efficiently to those insulin receptors, which causes the pancreas to have to produce more and more insulin in an attempt to get the process to work properly. Some of the insulin will bind, but it means your body has to work much harder to keep the blood sugar levels stable. So even eventually, if the pancreas can no longer produce any more insulin, then the blood sugar levels will start to increase, and that's what is type 2 diabetes. So it's common in conventional medicine to check blood sugar levels on health screening. Most of my patients have had that done at one point or another. It's not as common, however, to check for insulin resistance. And the gold standard for checking for insulin resistance is to have someone do an oral glucose tolerance test, which involves drinking a beautiful orange drink. It tastes like McDonald's orange drink concentrate, for those of you that may remember that. So it's a 75-gram glucose load. And 2 hours after you've drank that solution, you then would get your insulin level checked. So what I often see when I have patients do this test is that their glucose is totally normal at the beginning and at the end of the 2 hours. But if insulin resistance is present, they'll have had to produce a whole lot of insulin in order to handle that glucose load. So it means that their body is having to work really hard in its attempt to keep the blood sugar levels in that range. So what does that mean for weight loss? If energy isn't efficiently being produced from glucose in the mitochondria, then the body will hold on to body fat, because it's a less efficient method, but it is another way that your body can produce energy. Higher insulin also results in more inflammation, and inflammation is also the root of many chronic diseases and something that prevents our bodies from functioning optimally. So often with insulin resistance, I will see on body composition testing that a person has a really high body fat percentage despite having a really good muscle mass. And obviously this is assuming that the person is exercising. So that's what I mean. If a person is doing enough activity to build muscle, then there must be a reason why they're still not burning body fat. So what can be done about this? The good news is that this is totally addressable with lifestyle changes and also using some supplements to help address the insulin resistance. The supplements alone won't work well without the dietary changes, but they do help to speed up the changes when they're used together. And with the two together, I expect to see a noticeable reduction in insulin when the blood work is retested in 3 months' time, as well as the person reporting that they're noticing their weight is starting to change. And when I do the body composition testing, they are starting to burn body fat, so their body fat percentage is going down. So if some of you feel after hearing this that insulin resistance may be an issue for you, it's very common. If you have a family history of type 2 diabetes, that is definitely a big red flag to look to see if insulin resistance is something that's a concern for you. People who have polycystic ovarian syndrome or very irregular periods, that's also associated with insulin resistance. And definitely, just like I said, if you've been having a hard time losing weight and you're really trying to make the changes that you think should help with that, then I strongly recommend that you see a naturopathic doctor or another healthcare professional that understands this concept, and then together you can work to see what can be done. As I said before, you also need to make sure that you have that foundation of eating a balanced diet, exercising in the right way, and managing your stress. A diet that is higher in protein and healthy fats is something that is good for keeping everybody's blood sugar levels more stable, and we will feel much better if we have stable blood sugar levels, and that's whether you have insulin resistance or not. So that is why that's the basis for the meal plans in my online program called Your Best Life. The next group will be starting on June the 5th. So if you're interested in more information or you'd like to join, the link will be posted in the comments just after this video gets posted. So I really hope you found this information useful. If you have any questions, feel free to post them in the comments. And I hope that everybody has a wonderful long weekend. Thanks again for listening.